In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
I'm here at the Central OR at the Berlin Charité at the Department of Urology, and this is the director of this department, Dr. Miller. Thanks for inviting me today into your clinic. We just saw a report where you can reduce the size of the prostate gland by restricting the blood supply. What do you think of this method?
Well, it's pretty new and it's pretty in its infancy, so we don't have large evidence how it really works in comparison with the standard treatments. However, in certain subgroups of patients it might be beneficial. For example, we don't need anesthesia for that. Okay. So in frail patients, in very elderly patients, that might be a nice step to do.
But the standard procedure is still, which is called TURP, which uses a laser, for instance, or some electrical current to reduce the size of the prostate gland?
TURP is, it's the standard treatment that has been applied for like 50 years. Now we're more doing with a laser. It's pretty much similar, but with the laser you have a little less blood loss, but the effect is pretty much the same.
We got a viewer question from Australia. Kay Clues wrote to us, and he's going to have a procedure and wants to know what the risks are that this procedure will make him impotent or incontinent.
His risk actually of getting impotent and having incontinence is very, very small in that situation, because nerves are outside the capsules, we're not hitting the capsule, and we see exactly where the sphincter is, so no worries about this.
Why do you have to operate on a prostate gland in the first place if it's enlarged? I mean, there are some medications you can try to use.
In the early stages, we actually use medications, and the number of operations on the prostate has decreased over time. But in severe cases where there's residual urine, where the bladder is enlarged, where the kidney is jeopardized, we need to operate on these patients to make the way free again to urinate.
Why gets the prostate gland larger in life for men after the age of 45?
Well, this is still not quite clear. The paradox is that testosterone slowly decreases over time, and we know that we need testosterone to enlarge the prostate. Okay. So it's still not quite clear. All we know is that maybe the testosterone gets to the prostate on some different ways or things, and then that might be the reason the prostate enlarges in elderly patients.
Is the enlargement of the prostate gland the same all over the world, or are some countries where men are less affected?
Well, we're not sure. In Southeast Asia, prostate cancer incidence actually is reduced. I'm not quite sure if BPH, which is benign prostate hyperplasia, is also reduced. So there might be difference, but it's not that much as in prostate cancer.
And why is this enlargement of the gland a problem?
Well, because the prostate sits under the bladder, and if it starts growing, it also narrows the urethra, and patients start having problems voiding their bladder. And this can come to a point where they are totally unable to void the bladder. And that's a pretty poor situation, and that's why we need to do something about it.
It's painful.
It's painful. Yeah.
Right. So how do you distinguish between a normal upper PSA level or a dangerous one?
Well, recently we recommend patients to undergo MRI, magnetic resonance imaging, which gives us a better risk assessment than with PSA alone, because we can say if it's negative MRI, most patients do not need to undergo biopsies, whereas if we see something in the MRI, we can do a better biopsy by fusing the imaging of the MRI and the imaging of the ultrasound, and then we get better results with the biopsies.
But even if you suspect that it's cancer, if you know that it's cancer, you don't always have to operate and perform surgery. So how do you distinguish, and how do you say, this is my plan?
We try to distinguish three different types of cancer: low risk, intermediate risk, and high risk. Low risk, usually you recommend active surveillance for the patient. There might be exemptions, but that's what we usually do. And then intermediate risk, there's some discussion: should we operate, should we do nothing, or should we do focal therapy, which is still a little bit in its infancy, but you can still recommend it. And then in high risk cancer, we usually recommend, if there's no metastasis, to do operation or radiotherapy.
Right now we're in an operation room, and you're operating here on a prostate cancer patient, but this is not a normal OR. There's a robot making the surgery.
It's actually not the robot who is doing the operation. It's a surgeon who sits at the console. The new thing is he does not stand directly at the patient. And it's kind of a laparoscopic operation, but the movements of their instruments are initiated by some console, and it's you can initiate very fine movements. So it's a step forward in comparison with standard laparoscopy.
And what are the benefits of those kinds of surgery?
Well, if you compare it with traditional surgery, the benefits might still be small, a little less bleeding or something. There might be other benefits, specifically in obese patients, but I think what's best in the robotic surgery is the perspective. In the future, you can maybe fuse images into your picture that you see, and other things that actually makes operating much easier.
What happens actually to this patient? I mean, do you just remove the prostate gland?
It's correct. It's the traditional approach, even if you do it with the robot, is to remove the prostate gland if there is aggressive prostate cancer, and that's what we do right now.
How big are the chances that the prostate cancer can return? This is what our viewer Christian Oyotes from France wants to know.
Depends a little bit on the staging and on the grading and the aggressiveness of prostate cancer, but I would say if it's combined within the prostate, has not gone through the capsule, and the lymph nodes are not involved, the chance of recurrence is less than 10%.
Many of our viewers wanted to know if having sex on a regular basis could be preventive for prostate cancer.
There is some evidence that the number of ejaculation, or if you have many over your lifetime, it may reduce the risk of prostate cancer, but that's far from being proven. But actually the good thing is it does no harm.
So you could try.
You could try, yeah.
Thanks so much for inviting me into this futuristic operation room. Thank you.